Hi, my name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office, and my agents and I, we assist people with their Medicare nationwide. Assisting people with Medicare also refers to Medicare Part D. All of our agents are AHIP certified to help you with Medicare Part D, your drug plan for 2021. Something I want to go over today is how the 2021 Part D drug plan deductible works. Right now we have access to the new plans, and we're seeing that the average deductible is about $445 for most of the drug plans for 2021. But then when you run the meds, it can get confusing because you see that some meds are being covered right away and some meds aren't until you reach that deductible. So how does that work? Well, I kind of coined this phrase called a tiered deductible, and here's why I call it a tiered deductible. For most plans for 2021, the deductible only applies to medications that are Tier 3 or higher. So Tier 1 and 2 do not apply. So what does that mean? Well, there's 5 tiers in every drug plan. Tier 1 is your preferred generic medication. Tier 2 is your non-preferred generic medication. Tier 3 is your preferred brand. Tier 4 is your non-preferred brand. And Tier 5 are your more expensive specialty drugs. So if you're taking generics that are a Tier 1 or a Tier 2, so non-preferred and preferred and non-preferred generics, then the drug plan kicks in right away and you do not have to satisfy that $445 deductible before the plan kicks in. Also note, those meds do not count towards you satisfying that deductible. So most of the time you're gonna see a Tier 1 preferred generic being covered for $1 or $2, and you're gonna see a Tier 2 being covered for $3 to $5 on most plans. Now, it's important to understand that there's 5 tiers within the formulary that determine this. It's also very important to understand that not all drug plans have the same formulary, and therefore, not all prescriptions also fall within the formulary on the same tiers. So you could have drug plan A versus drug plan B, and you could have, say, lisinopril, which a lot of us take for blood pressure. That could be a Tier 1 on drug plan A and a Tier 2 on drug plan B. So what does this mean? And how does this help? The main point of this video is to share with you that even though you might see a plan that has a $445 deductible, if you're taking all generics, it may not be a bad idea, because as long as they're those Tier 1 and 2 generics, then you do not have to satisfy that deductible. How can you calculate this and make sense of this and apply it to your choice for 2021? Well, I'm going to put a link to our website below to our Part D Finder form, and I'll put our phone number. And what we can do is you can give us a list of your prescriptions. We can run them versus all the drug plans for 2021. And we can help you make a determination on which one is the most cost effective for you based on what we call estimated annual cost. That's really what should determine your choice for your drug coverage, is which drug, so here's how simple it gets, right? MedicareBob, which drug plan is gonna save me the most amount of money based on my prescriptions? And that's where we help. Once you complete our Part D Finder form, or you call in and speak to an agent and give us a list of your prescriptions, we're gonna run them through all the different drug plans and compare them. And we will recommend the drug plan that saves you the most amount of money based on annual cost. Well, what's included in that annual cost will be your monthly premium, annualized, so your monthly premium times 12 months, your deductible, which will be calculated if it does apply to your prescriptions or doesn't, and all of your copays, whether you do hit the donut hole or you don't. It's going to calculate everything into a nice number of estimated annual cost. We can compare that to your current drug plan for 2021 with the changes it's making and help you find the most cost-effective one. Can sound complicated, takes us about 10 to 15 minutes to do. This is just what we do all day, every day, especially during the annual election period. Remember, it's important to shop your drug plan. It's an easy way to save anywhere from $200 to even $2,000, depending on the meds that you take. It takes us about 10 or 15 minutes to do that for you. It's really simple for us to do it just because we do it all day, every day. You're allowed, the new drug plans are published, the 2021 drug plans. They came out October 1st, so we're already seeing them. And you are actually allowed to make a change starting October 15th, but we're actually allowed to do the research for you now so you can beat the rush because we have access to them now. But we won't submit your change to October 15th. You're allowed to submit a drug plan change during the annual election period, which is October 15th through December 7th. And the new change for your drug plan will take effect January 1st, 2021. You do not have to cancel your drug plan because by submitting a new drug plan that will automatically notify your current Part D carrier that you've switched effective January 1st, and you don't have to do anything to cancel, it'll automatically cancel out. If you would like help with your Medicare Part D or anything Medicare, supplement, Medigap, Medicare Advantage, dental, vision, hearing, any question about Medicare, Senior Healthcare Direct, MedicareBob's office. We are licensed and appointed in 48 out of the 50 states. I'll put our phone number and a link to our website in the description and link. So just reach out to us. You could also follow us on Facebook. You can just look up MedicareBob. We have over 100,000 followers. You can also go to our YouTube channel and subscribe because we publish new content all the time to keep you informed about all your Medicare options.